Welcome back at 7:12, and this morning we want to bring you an important health warning.
Yeah, it's about strokes. Nearly 800,000 Americans suffer them every year, according to the CDC, and that's one stroke about every 40 seconds. The onset of a stroke on full display this week when a news anchor from Oklahoma named Julie Chin suffered symptoms live on the air.
The Tulsa Air and Space Museum is hosting a launch today at the event. The event features live. I'm sorry, something is going on with me this morning, and I apologize to everybody. Let's just go ahead and send it on over to meteorologist Annie Brown.
So that was really tough for all of us to watch. And here to help us understand strokes better is Dr. Mitch Elkin. Good morning. Thank you so much for being with us.
Good morning. Thanks for having me.
So, we watched that clip. We just saw it replay over and over again. So what we're seeing there was obviously very frightening. Was that the beginning of a stroke? What was happening in that very moment?
That's a great question. It certainly could have been the beginning of a stroke, and that would be the worst thing that could happen, and certainly needs to be evaluated immediately because of that. It could have been something else in the end, and that's why you have to be evaluated to make sure it's truly a stroke. So very worrying symptoms, agreed.
And so before we get into the rest of this, let's talk about what exactly is a stroke.
Yeah.
Well, a stroke is damage to the brain that's caused by a problem with a blood vessel. So it could be a blockage in a blood vessel leading to a lack of blood flow, so the brain tissue suffers and could even die. Or it could be rupture of a blood vessel leading to bleeding into the brain that damages surrounding tissue. Either way, it can be life-threatening and certainly threaten the function of the person who's having it.
Right, and we hear all about strokes, and people sometimes joke about it, right? If they're having trouble speaking. So, are there more people that are susceptible to strokes? Does blood pressure play a role? What are you looking for here?
Absolutely. Well, the biggest risk factor for a stroke is high blood pressure. You're absolutely right, and so that's why it's so important for people to know their numbers, know your blood pressure. Other risk factors: high blood sugar or diabetes, high cholesterol. Certainly smoking is a major no-no that can lead to strokes as well as heart disease. These are all things that people should be watching very closely.
And you have this acronym FAST on things to look out for. What should people be doing if a symptom is showing up?
Exactly. So FAST stands for face. There you have it. Face, arms, speech, or time. And it means if you see the face drooping, or the arm is weak, one side of the body can't lift the arm up, or there's difficulty with the speech, either speaking, as we saw in the video, or understanding someone else's speech, then it's T, time to call 911.
Yeah.
That's the simplest way to remember the symptoms of stroke.
Okay, so that anchor we saw in that clip says before she actually showed the symptoms, excuse me, where she was having trouble speaking and getting those words out, that she actually lost partial vision in one of her eyes. Now, you're saying that's another warning sign of a stroke here, but while it's all happening in the moment, you may not realize what's happening to you, right? So how far does it go before it becomes really life-threatening?
Well, it's, as you say, sometimes when people are experiencing the symptoms of a stroke, they can't call for help if they can't speak, for example, at all. I mean, the anchor we just saw, we were fortunate that she was able to talk to her colleagues a bit. But some people can't speak at all, so they can't call for help, or they may not even be aware of the problem. That's why it's essential that other people around, either family members, coworkers, others on the street even, recognize those symptoms so they can get attention for the person. We've seen people, kids even, on the subway platform call 911 when they see someone on the platform having those symptoms. You can really save a life.
Yeah, as we were talking a little bit before the interview came off this morning, Doctor, we said that typically we associate strokes with being an older person's issue. But I'm thinking with so many Americans dealing with being overweight, hypertensive, diabetes, high blood sugar, smoking, that this could push forward into a lot more of the population. So what can we do to prevent strokes?
Absolutely. Well, we have seen an alarming increase in strokes in young people as well. People have to remember that strokes can happen to anyone, even children, rarely, thankfully, but even children can have strokes.
Yeah.
So the best way to prevent them is to watch your blood pressure, manage those other risk factors we talked about, even simple things, getting enough exercise. There you go, 30 minutes a day. of physical activity, watching your weight, knowing your numbers, maintaining a healthy lifestyle. Those are all great ways to prevent a stroke.
I want to squeeze in one more question here because we're almost out of time here. But when that anchor Julie was reading off the teleprompter, that's where she was really struggling. But then when she ad-libbed and wasn't reading, she seemed fine. So was there a difference there?
There can be. People can have difficulty reading but have the ability to speak. It can separate out understanding speech versus producing speech. The brain is complicated, and so there are a lot of manifestations. The simplest way to remember stroke is FAST, as we said, but there are other symptoms. So people can look further at stroke.org and learn more about the warning signs of stroke.
Yeah, and don't delay in getting treatment because that's really the key there. Dr. Mitch Elkin, thank you so much for being with us with the American Medical Association and the American Stroke Association.
Thank you for having us.